Coming up on One Detroit. COVID-19 may forever change the way you see your doctor. The rise in telemedicine, a special report. Plus, Governor Whitmer on plans to reopen Michigan's economy. Plus, easing the stigma surrounding mental illness during COVID-19. And then, the start of Ramadan is this week. I'm Christy McDonald, and One Detroit is coming up.
Support for this program provided by W.K. Kellogg Foundation, a partner with communities where children come first. The Cynthia and Edsel Ford Fund for Journalism at Detroit Public TV.
Masco Corporation is proud to manufacture innovative and environmentally friendly products for the home. Delta faucets, craft-made in Merillat cabinets, and Behr brand paints have all been designed with you in mind. Masco and its family of companies, serving Michigan communities since 1929. The DTE Foundation is a proud sponsor of Detroit Public TV, among the state's largest foundations committed to Michigan-focused giving. We support organizations that are doing exceptional work in our state. Visit dtefoundation.com to learn more.
Business Leaders for Michigan, dedicated to making Michigan a top 10 state for jobs, personal income, and a healthy economy. And thank you to these supporters. And viewers like you.
Hi there and welcome to One Detroit. I'm Christy McDonald coming to you from my house. Like you, we are staying put. I know a lot of you are home with your kids. Some of you have been laid off from work, or some of you are working under extreme circumstances. Here at Detroit Public Television, we are keeping you updated on the latest developments in the COVID-19 crisis and how it's impacting our area. For those new daily interviews, just head to our website at onedetroitpbs.org. We'll have all the information there for you. Well, it seems like we're all looking towards May 1st as a potential for the restrictions to be lifted if the number of COVID cases continues to come down. Coming up on One Detroit. I talk with Governor Whitmer about the plans to slowly open up the economy. Then Nolan Finley talks with businessman John Kennedy, whose manufacturing plant on the west side of the state is still open. He helped the GOP come up with their economic ideas. Then Stephen Henderson takes on the stigma of mental illness in the Black community during the unprecedented stress of COVID-19. But first, we're taking a closer look at the major change COVID-19 is making to medicine and how doctors are now treating patients.
Did I ever think that I'd be doing Zoom patient visits? I thought nothing short of a pandemic would cause that, but here we are.
3 weeks ago, you could not reach a patient on the phone and communicate and have a legitimate ethical visit. Well, you can now. Love him or hate him, Trump said this is equal to a face-to-face visit. This. Because we needed people to see people.
So what happened is the government sat back and said, we've got patients that need to have immediate access to their physicians. So we're going to relax those requirements and we're going to allow for conversations to be happening over the public channels. Ones that you and I and our children and others have been using for a long time, known as either Google Duo or FaceTime or some of the other products that are currently available online for us to communicate with families overseas, for example.
Of course, telehealth really was a thing before COVID-19, seen in rural areas like Mississippi in this public TV report before the pandemic, when HIPAA rules required more expensive communications technology. Dr. William Maroney has been pushing for more telehealth while practicing addiction medicine across Michigan's thumb.
Now we're looking at it happening everywhere. And it just 3-4 weeks ago, right?
Right. And it should be happening everywhere because, Jesus, Mary and Joseph, it's 2020. We've been hearing about telemedicine for 40 years.
That we had to literally shift our entire way of doing business unexpectedly and within about 4 days.
In Detroit, the Children's Center's mental health services pretty much all now delivered by telehealth.
So we had initially thought that we would decrease the number of people coming to our campus. And then we had a meeting with our executive leadership team, and it was decided, we think it's in everyone's best interest to just figure out how to do our job remotely.
Okay, so you hurt your elbow.
Michigan State University Healthcare quickly turned to telehealth. In East Lansing, they're finding new ways not to see patients in person.
We went from, in sports medicine, we didn't have telehealth at all. It wasn't on our radar at all. And then like within 7 days, it was live. And so we've had to adjust the way we interact with patients, adjust the way that we perform visits. It seems silly, but for me, looking at joints and how people interact and move is still very important. And so we have people at home that I'll have them, a spouse hold the computer while they walk around or while they move their knee or move their shoulder, so we can still deliver the best quality care that we've always delivered, but just in a fashion that enables the patient to remain safe.
Detroit area psychiatrist Terry Vigor sees an opportunity with seniors.
It doesn't seem to be a big deal as long as they have a cell phone. The rate limiting factor is, do they have a cell phone? And then number two, if they do have a cell phone, do they have unlimited or enough data to be able to use the platform?
Dr. Vigor has started using the Doximity app with her patients.
Or search for a phone that's near you.
She calls it Facebook for Physicians. Seniors with just landlines can't use it, so she started a nonprofit hoping to raise money to buy them smartphones. It's all about ease of use.
And then at the bottom, if you can see, all I do is tap video call or phone call. The patient gets a phone call, like an ordinary phone call, and then they'll see something to touch, that says I give permission, and that's it. That's all there is to it.
Then there's another component of telehealth that's easier, getting the money.
Limited reimbursement results in limited access. And so that was I believe the biggest changes. The technology was always there. And so now the fact that it's paid and paid by their insurance, it makes it more viable.
And what's happened is suddenly physicians are getting paid for the time that they are providing. If you and I are having a 15, 20-minute conversation, in the past, a physician would not be compensated for having that type of encounter. And yet they should be, because there is medical decision-making that is occurring. Up until 3 weeks ago, there was no payment for that. Now there is.
Are you worried that this may not continue after this COVID-19 crisis subsides?
I think that they will see the advance of technology saved lives and money.
Studies of telehealth's effectiveness, they'll come in time, but Detroit area healthcare provider Eva Matashevsky has a plea for Lansing regulators now.
The request of the governor of the state of Michigan, please don't go ahead and pull things back. The healthcare community has to realize we are going to be experiencing severe PTSD. We will not have enough behavioral health folks to be able to meet the needs of those individuals that will be struggling with mental health issues. So it's extremely important for us to not only maintain, but perhaps enhance what it is that we currently are doing in the way of telehealth.
The number of positive tests are starting to fall and come down. Everyone is looking towards this May 1st date. Are there any plans to ease restrictions before May 1st?
Well, we are looking at the data every single day, and we're going to continue to do that for the weeks and months ahead, because what we know is that COVID-19 will continue to be present in some form. The goal is to keep it at a manageable number, to keep the fewest people from getting it as possible, to re-engage in a thoughtful manner certain sectors of our economy. And so I can't, 10 days ago, I couldn't have predicted that we would see this leveling off. 10 days from now, I can't predict precisely what we will see in the interim, but I do know if everyone continues to do their part, we can thoughtfully think about how we might re-engage certain sectors of our economy. But it will be coming in waves, and we're going to be assessing every step of the way.
All right, so let's talk maybe about some of those details, because I think there is a simmering frustration. People see that Georgia is going to be opening up on Friday. They see news coming out of South Carolina. Republicans in the state have put forth 2 plans with some details and specifics about how they'd like to see things open up in waves. What are some of the details that you can share with us that you're working on right now with your task force? And is there anything in the Republicans' plans that they put forward that you find valid?
Yeah, sure. I think that there are some good thoughts there. I think that there are good thoughts from what the guidance was that came from the White House. This group that has come together, the Economic Recovery Group, is really doing a rigorous amount of work looking at the data, understanding all of the different economies and the different aspects of sectors of our economy, rating them for risk, asking the tough questions, and having University of Michigan Medical kind of weigh in and give us counsel as to what's riskier than other things, what we can do to mitigate that risk, what protocols we need to adopt. Asking questions, I mean, lots of questions, but a couple of examples. Is the work done primarily inside or outdoors? Is the work one that engages directly with the public, or is it like office work or work that is behind the scenes? Is it work that there is shared tools or machinery where people are touching the same thing? You know, each of these is a factor that goes into the determination of how much risk there is in terms of passing on COVID-19. And so as we are assessing this, I think we'll be able to really show people how much thought has gone into this. We'll take some lessons from different groups that are weighing in as well, and I'll make a decision based on all of these factors, how we think we can safely start to re-engage certain sectors of our economy.
It's very tough to talk about reopening if the amount of testing isn't able to ramp up to other levels that other states have. We've seen many reports that Michigan is still lagging behind in the number of tests.
We have capabilities of doing twice as many tests as we are today, maybe up to 3 times as many. What our struggle is right now is getting the swabs and the reagents. That is something that I know every governor in the country is echoing as we have our conversations with the federal government and the White House. We were on a call yesterday with Mike Pence, and that was a consistent theme across the country. These implements are absolutely essential to getting this testing capability to maximum capacity. And yet, this is where we need the most help from the federal government.
Let's talk a little bit about the budget. Obviously, things are going to get tougher here in the state of Michigan. Are there any conversations you're having right now about furloughing state workers, or have you started to take a look at what you might start to carve out of the budget?
Yeah, well, as you probably saw, I've said I'm going to take a pay cut. I know that we are going to have to make a lot of tough decisions here in state government. Of course, the shutdown of an economy means that we are feeling it, and we're going to have to face some potentially deep cuts. I'm hopeful that the federal government gives us flexibility with those CARES Act dollars. We've gotten about $3 billion will be coming to the state of Michigan. That will help go a long way. We know that our kids are going to need additional support as they contemplate going back to school in the fall. And so there are a lot of different factors, but we are analyzing the budget and looking to see where we need to pull back. We have a hiring freeze. We've already done a number of things to cut spending, but ultimately, as we think about next year's budget, we're going to be making some tough decisions in the short term.
John Kennedy, President and CEO of AutoCam Medical and chairman of the West Michigan Policy Forum, which on Friday endorsed Senate Majority Leader Mike Shirkey's reopening strategy. First of all, how do you define his strategy? How do you see his strategy? And what do you like about it?
Well, what I like about it is it actually follows the learnings that we have and other people have had. And if you go to the OSHA guide, it was taken from the way the OSHA standard has been written on a national level. And basically, it's a risk-based approach. There are low-risk businesses, and there's medium-risk businesses, and there are high-risk businesses. Mm-hmm. And to the extent you're a low-risk business, I think you could open today, because the way we look at it and the way we talk to our employees about it, it is much greater risk for them to go to the grocery store,
yes,
pick up their essentials, than it is to come into our plant and work.
Good point. Now, what would constitute a low-risk business versus a high-risk business?
I think businesses where you can easily maintain the social distance, because that, in my mind, is the biggest thing we can do.
Whether it's indoor or outdoor, right?
Right. And outdoor, I think it's easier. Mm-hmm. And, you start looking at a construction site or whatever. And once again, if you can't maintain the 6 feet of distance, I have a different view. We have 3 facilities. We have no guests in the building. Everyone gets their temperature checked and et cetera, and they're wearing a mask the entire time they're there. There's nobody in for a meeting. We do everything virtually. And those are just, I think, really good practices that can make businesses extremely low risk.
So, John, is the West Michigan Policy Forum urging Governor Whitmer to adopt the Shirkey plan?
Yeah, I mean, I think the Shirkey plan has been put out there as a suggested way forward, and I'm not saying you couldn't, around the edges of that, maybe there should be some differences. Maybe there should, have procedures. And particularly as you start getting into the higher risk stuff, I think one of the problems I have is, I feel for the restaurants, but on the other hand, I'm having trouble understanding how you make that a particularly low risk business or lower the risk to the point where, in my mind, that's going to be one of the last things that we're probably going to be able to open back up. We're in the same position as the governor. We want to basically have safe operating practices. And what I would say is that where she's at right now, there's a lot of stuff that we could be doing that would be actually helpful to maintaining our environments safely.
Willie Brooks and Hadari Brown, welcome. So Willie, I'm going to start with you, whether you're somebody who is close to someone who's sick or has died because of this, or just living in an environment where that is what's going on around you all the time, and you're enduring all the changes that have happened in our lives since this started. I think it touches everyone in a really profound way.
Other individuals in other parts of the world are already accommodated to wearing masks, social distancing, whereas with our culture, especially in America and in the Black community, it is a completely new culture change of being isolated, having to wear a mask, understand the importance of wearing gloves. That is why you can see the impact in Michigan, especially in Wayne County, are so drastic because of that culture change and so many other dynamics that are out there.
Hadari, you're a military veteran and somebody who has dealt with anxiety and depression brought on by stress and trauma. Tell us about your experience, and then tell us how you're experiencing what's going on now.
My experience comes from combat, but also the transition of coming back home and trying to just de-escalate from the military environment back to what we call the regular civilian life. But now with the coronavirus, one of the things I've noticed myself, even before it hit the height here in America, was like, people going to the store and just buying everything off the shelves like it's the end of the world, really put me in a fight or flight mode. And even right now, one of the things that I've had the difficult really just trying to deal with is really just to keep appointments. So instead of having that face-to-face appointment with my mental health counselors, we've had to go through Zoom calls or telephone conference calls. But it's still, as you mentioned, it's still tough because in the African-American community, we're used to those face-to-face interactions because that really helps in the process of really dealing with depression and anxiety as well as grief overall.
Willie Brooks, talk about the role that your agency is playing with people like Hadari Brown right now, the kinds of things that you're having to make available.
Anyone can get on our website, dwihn.org, and receive information on how to cope. And there's a couple of things that people should understand. This is going to change the way we interact for at least 12 months to probably 24 months. Mm-hmm. The fact that it's so unpredictable and that it can hit any age range, any person, it brings on a sense of terror. So you have to try to correct that with having a lot of facts and reality in your life. It is not helpful to look at COVID-19 from the time you wake up to the time you go to sleep and just looking at the numbers.
Hadari Brown, I want you to talk about what you would say to someone who's really experiencing anxiety or depression as a result of trauma the way you do, what would your advice be?
My advice to someone who's experiencing trauma, depression, anxiety, or even overall grief right now is to really seek out help. The Detroit Wayne County Integrated Health Authority is one thing. You also can reach out to an organization I work with called NAMI, the National Alliance of Mental Illness. And then even reach out to your own personal care provider and see what resources they might have for you. Really, and then talk to your friends and family. You know, reach out to them on a regular basis. Don't go through it by yourself, you know, because everybody right now in this pandemic is really going through a little bit of grief, anxiety, or depression at some point or another.
Yeah, it's okay to say you need help. That's great advice.
One of the holiest months of the year for Muslims begins on Thursday night, and that is Ramadan. So joining me now to talk a little bit about that is Dima El Gamel, and she is a community member of the Muslim Unity Center. And also with us is Imam Mustafa El Turk from the Islamic Organization of North America. Imam, if you could start off explaining to people exactly what Ramadan is.
Ramadan is the 9th lunar month of the Islamic calendar. And it is a month of fasting. God Almighty says in the Quran, "O you who believe, fasting is prescribed to you as it was prescribed to those who came before you, so you may remain conscious of God." So it's a month of spirituality. It's a month of fasting where Muslims abstain from food and drink from dawn until sunset. So it's a very spiritual month. It connects the families together, the community together.
So Dima, how does COVID-19 change the way the community will come together this month?
Actually, it's emotionally overwhelming to even think about Ramadan coming, even though that we saw that coming with our friends, the Christians and the Jewish communities recently celebrating holidays. But still, the social distancing being in place, the Muslim community has come up with a lot of activities and a lot of spiritual activities as well as social activities that take the social distancing from the physical spaces into virtual spaces.
We are encouraging the families to connect with their extended families through the social media and whatever our smartphones apps provide for our communities. However, we are connected with them through virtual live stream feeds with lectures. I will be delivering a nightly lecture going over the Quran with the community through YouTube and Facebook and Zoom and other resources.
When we are faced with times like this where we don't know what the future holds, where things change from day to day, Dima, how important is it for us to hang on to our faith, our spirituality, to still do the rituals within our own homes that help bring us some peace?
With faith, with testing comes ease, and with every hardship comes ease. And the faith, the belief, just like any other faith, it is very, very important to maintain that faith in God, and that there is always hope, and the love from God will get us through this, and together we will get through this unfortunate circumstance.
Imam El Turk, this must be some of the most amazing times that you've had to be a faith leader. How would you describe what we're facing right now and what you're able to tell people?
This is what we call divine decree or divine destiny. We accept it as it is. And yes, as an imam, it is very difficult to console people who are so very much attached to the mosque, attached to the community, but we have to be resilient and we have to take things with fortitude, be patient and endure this time.
And that is going to do it for One Detroit. For our daily COVID-19 updates, just head to our website, onedetroitpbs.org, and across our social media platforms. All right, we're going to leave you with a little moment of zen here. I couldn't resist when I saw it on Facebook. John Roach, who works for the city of Detroit, posted this video. It's of daffodils that are in full bloom along Arden Park between Woodward and Oakland in Detroit. Go ahead, take a look and enjoy. And I'll see you back here for One Detroit on Monday. Take care.
You can find more at onedetroitpbs.org or subscribe to our social media channels and sign up for our One Detroit newsletter.
Support for this program provided by W.K. Kellogg Foundation, a partner with communities where children come first. The Cynthia and Edsel Ford Fund for Journalism at Detroit Public TV.
Masco Corporation is proud to manufacture innovative and environmentally friendly products for the home. Delta faucets, craft-made in Merillat cabinets, and Behr brand paints have all been designed with you in mind. Masco and its family of companies, serving Michigan communities since 1929. The DTE Foundation is a proud sponsor of Detroit Public TV, among the state's largest foundations committed to Michigan-focused giving. We support organizations that are doing exceptional work in our state. Visit dtefoundation.com to learn more.
Business Leaders for Michigan, dedicated to making Michigan a top 10 state for jobs, personal income, and a healthy economy. And thank you to these supporters. And viewers like you.